Hi everyone. Today I'm going to answer a question that I get asked a lot. And that question is, what about my cholesterol? You're telling me to eat all this fat, but I already have high cholesterol, or my family history has high cholesterol. Should I really allow my cholesterol to be that high? How can I eat that much fat? So today we're going to talk about what the real role of cholesterol is in our bodies. Now, we measure cholesterol as a blood test to detect the level of risk for heart disease. But what we really should use cholesterol to do is to use it as an inflammatory marker. Cholesterol really shows us how much inflammation is in our bodies, and that is the way we should use it. Let me explain what I mean. Alright, so let's go ahead and look here. So we have this to represent the blood vessel. This type of injury generally happens in an artery, which is a high pressure, high flow vessel in our bodies. So if something comes along and damages the wall of the vessel, it could be a toxin, could be from chemicals that you put on your skin or eat in your food. Sugar is a really big factor in this and often causes this type of damage. So if something comes along and damages it, well, the body's not able to heal that right away. It doesn't instantly happen. And so the body creates a plaque, a protective band-aid, if you will, over that area of damage so that it can fix it. When it goes to fix it, it sends LDL cholesterol to that area. LDL cholesterol drops some stuff off, picks some other stuff up, and leaves again as HDL cholesterol, which we have been taught to call the bad and the good cholesterol. But if you look at what the body's actually doing, both of these types of cholesterol are working in the process of healing inflammatory damage. We can think of these as ambulances. But if we did, we would have to call LDL the bad ambulance because it went to the scene of the accident, and HDL the good ambulance because it left and was helpful. That's ridiculous. Of course, that's not true. So we see here that both of these types of cholesterol are actually working in the process of inflammation. So cholesterol is really an inflammatory marker. The more ambulances the body feels like it needs to produce, that means there's more and more damage in your body. If we want to fix the problem, should we limit the amount of ambulances, or should we work on causing less accidents? So the accidents here are the issue. Now, what causes the accidents? This is inflammatory damage from toxins. Toxins are anything that's not helpful to the body. So they could be chemicals, they could be toxins produced by our gut flora or other bad flora in our bodies, but they can also be from certain foods that we eat. Processed foods, processed sugars. Anytime the blood sugar is really high, you have this issue. Anything that causes oxidative damage can cause this problem. And refined carbohydrates can do it, and any nut or seed or grain that's not properly prepared can easily cause this type of damage. So as you clean up your diet, as you get rid of those things or prepare them properly, then you have less damage, and then your cholesterol will be lowered as a result. It's not lowering cholesterol that's our purpose or our point. In fact, the cholesterol should be as high as it needs to be because the body needs as many ambulances as possible to take care of any problems going on in the body. What we need to do is have things we need to focus on working to reduce the inflammation in our bodies, so then our cholesterol can go down. I hope that answers your question. If you have other questions, let me know. I'd love to take a shot at explaining them. And I hope this makes sense. Comment below if you have any questions or thoughts, or if this doesn't make sense to you, I'd be happy to point you to more resources and the research that shows that this is true.